my nurse today. I'm a student nurse in level 1. How are you?
Good. How are you doing?
Good.
Would you like a SBAR report?
Oh, yes, please.
Okay. So our patient is Miss Marta Yarn, and she's 80-year-old female. She's in room 529, and she's resting right now. Her doctor is S. Jolly, and she's a full coat. She has no known allergies. A little bit of history about her. She has a history of dehydration and pneumonia. And she currently, her primary diagnosis right now is a sacral ulcer on her bottom. It's a stage 3. It's a full thickness tissue loss with subcutaneous tissue. It's a little visible. She has an IV in her right dorsal metacarpal hand. It's a 20 gauge. And right now, in the chart, it says she was having some pain, but we'll come in and we'll ask her if she's having any. So she's cooperative. She's feeling a little anxious. She's oriented ×4. Her respirations are 24. They're even, effortless, and clear. Her cough is non-productive, though. Cardiovascular, she has no murmur. She has an S1, S2 sound. Her apical pulse is regular. Her extremities are pulses +2. Her capillary refill is less than 3 seconds. For GI, she's on a regular diet, but she's NPO after midnight. So we have to make sure that she doesn't have anything after midnight, nothing to eat or drink. Her bowel movement is normal and firm. She has a soft abdomen. She has bowel sounds ×4 in all 4 quadrants. She's about 175 pounds. And then her output was 850, and her input has been 350. So we just want to keep an eye on her in and outs. Her vital signs, last checked, her blood pressure was 144/90. It's a little high. Her O2 sats are 92. Her heart rate's 88. And last time we just checked her temperature, it was 98.9. And her labs are pending, but we did get back a stat E. coli test, and that came out negative.
Okay, thank you very much. So what meds are we giving today, and why is she getting it?
So we're going to start Miss Marta on some 0.9% normal saline, also known as sodium chloride. And this is just a maintenance line to give her. And then she also has an order for gentamicin. It's an antibiotic.
Okay. Does the gentamicin have a therapeutic serum level?
We have some labs here that we have to check. So she has a trough level that we have to monitor. So with the trough level, so we need to know how much is in her system. So there's a toxicity and an overdose amount. We monitor her blood levels periodically during therapy. The timing of blood levels is important, interpreting results. We draw the blood for peak levels 30 minutes. After 30 minutes of IV infusion is complete, the trough level should be drawn just before the next dose, and the ranges for those are, the peak range for an adult is 4 to 6 milligrams per milliliter, and the trough level is 2 milligrams or 2 micrograms per ml for adults.
Oh, okay. When should you question administering this medication?
So we want to question giving her the saline if she has an electrolyte imbalance, if she's having fluid overload. We don't want to give her more fluids. For the gentamicin, we would question giving that drug if she had her trough and peak levels came high, so we know there's too much gent in her blood, so we would hold. We wouldn't want to give her any more. And if she was having any kind of allergy to any of those drugs, we wouldn't give the drug.
Let's see. What interventions must be taught to the client to ensure this medication is administered safely in the hospital setting?
So to administer safely in the hospital, we would just want to double check on her allergies. We want to monitor her vital signs, and we want to make sure we've got the right drug order and we're giving the correct dose, and doing all of our protocols, right route, right drug, all that.
What interventions must be taught for taking this medication safely at home?
So the drug, it can be taken by pill form, or it can be given intramuscular injection. So if she was going to take that drug at home, she would have to, know where she can inject herself, and if she had a nurse there, like a home health nurse, giving the right amount of drug, getting her blood tested, and knowing what her levels are, and checking her vital signs, making sure she's not having any problems with taking her injections or swallowing any pills. And then same thing like here in the hospital too, like if she can take an injection IM or swallow her pills okay.
How will you know that the medication is effective?
If we look at her blood labs, and we can see how her trough and peaks are doing, and then also if she's not showing any signs of an infection, her temperature has gone down, her infection is, her wound is getting better.
Okay, great. Hey, do you mind, can I watch you hang your meds?
Sure.
Hang your IV fluid in the piggyback?
Yes.
All right.
So we'll just have our supplies and get everything ready. We can do that before we go into the room. We can do this in the med room or a little prep area. So right now we're gonna have to give the saline. So we want to confirm everything with our MAR. So we have our order of saline here, and here's the label. And we just want to check the bag and check the expiration date, and it's 2019, so we're okay, and there's no holes, and it looks clear, and we've checked our label, and we're going to check that against our MAR in just a second here when we get it pulled up in the room. And our other order is for gentamicin, and we're checking the expiration date. It's 2019, and we have the drug name, and everything looks correct, and we're checking the bag and the clarity, and everything looks good, and we've already confirmed in the MAR what the order is. So we'll just come over here and pull that right up. So here's her MAR, and we're just gonna pull up. We have the saline to give, and we have the gentamicin to give, and the time that we want to give it. Right here it's saying we can give it at 1600. Right now it's 1500, so we're safe to give that. Same thing with the saline. We're going to give that at the same time. So the order says 1400, so we're safe to give it because it's 1500. So we've checked the dose and the drug and the time. Okay, so what we do is we have our tubing, and this is all in a sterile package, Lisa. And we just have our sterile cap here that we take off, and our sterile plug here that we take off, and we carefully just spike it sterilely. Okay, and we've already clamped off all the tubing. Everything's clamped, so we don't have any leaking anywhere. And this is the end that will go to the patient. So we have this all ready together, and when we go to hang it, we'll make sure we get the air bubbles out. And then for our gentamicin, we have the same thing. We have a piggyback line here, and everything's clamped off. So what we do is we take the sterile cover off, and we'll spike the bag and make sure we do that sterile. Okay, and everything's clamped off for now. So we'll prime everything when we get it hung up on the IV pole. So that's all ready to go. And then we have our dial flow that we'll need to connect. And we have our flushes that we'll need to use too. So we'll go in the patient's room and we'll introduce ourselves.
Okay.
So, knock knock. Hello, Miss Marta.
Hello.
I'm your nurse, Sandy, and this is Lisa, your student.
Hi.
We're just taking care of you today, and we have some drugs that we need to hang on your IV pole. I'm going to wash my hands, and you can too, Lisa.
Oh, thank you.
Miss Marta, I just need you to verify some things for me before we can proceed with giving you some medications, okay?
Okay.
So, can you just tell me your name and your date of birth?
Martha Yarn, 80 years old.
Okay, so we're going to look in her chart, and we're going to confirm that Marta Yarn is in the computer. She's 80. And Miss Marta, do you have any allergies?
No allergies.
Okay, so we just look in the chart, and she says she has no allergies, and that's correct. So, Miss Marta, have you ever received any antibiotics before?
No.
Okay, so I'm just going to give you a little bit of teaching.
Okay.
You have 2 drugs we're going to give you. You have a gentamicin antibiotic ordered. The doctor has ordered that for your wound. And some side effects to that are rash. So maybe you might have some sensitive skin. You might have some rash on your skin. You might have some hearing loss or kind of feel some dizziness. So just kind of remember those little side effects, and then I might ask you again about those later, okay?
Okay.
Okay. All right, so we're just gonna go in the chart, and we're gonna pull up her MAR, and we wanna confirm that we have everything correct. We wanna make sure we have the right route. So Miss Marta has an IV on her right arm. The route is IV. We have the correct route. We have the correct time because it is 1500. The doses can be given at 1400 and 1600, so we can give them now. The drug, we have the gentamicin, which is here. We're going to confirm. That's what we have. And if you hover over it, it'll tell you how much we're going to give.
I see.
Okay, 80 milligrams for 100 milliliters over 1 hour.
Yeah, and I see that.
80 milligrams, and this is 100 milliliters here.
Okay.
Okay, and we've already checked with pharmacy, and it's already mixed, and the drugs are compatible together. So we've done all of our safety checks with pharmacy and mixing the drug, so we're safe. And then the saline, let's confirm the saline bag with the MAR. So we have sodium chloride 0.9 with potassium chloride 20 milliequivalent units, 1,000 milliliters. So this is 1,000 milliliters, and the pharmacy has already mixed and confirmed potassium and the sodium chloride. So we're safe to give that, and that's 125 milliliters per hour, and that's a continuous dose. Okay?
Okay.
Okay, so we're going to hang the saline first, Lisa.
Show me how that's done.
Okay, so we're going to hang it on our IV pole here. And we have our tubing. And we just want to just detangle everything so that we don't have any kinks. When it comes out of the package, it's all nice and just ready to go. Okay. We just want to make sure we get all the little air bubbles out. So we have a little bucket here, and we can just kind of unclamp our tubing and give a little squeeze and see if we can get some air bubbles out. Okay, we're open there. Okay. It's flowing nice now. There we go, into the bucket. Okay. All right. We're gonna clamp that off because we have to get our alcohol wipes and our dial flow. And we have our flushes. Okay, so the saline, we're gonna give that. Okay. So before we give it, we need to enter in all of our patient
You want me to
information.
read it off to you?
Yes, if you can read her number off there and I can type that in.
Tell me when you're ready.
Go ahead.
594
Mm-hmm.
090 56
Mm-hmm.
52.
Okay, Miss Marta did come up. Now we need to scan the medication. If
You want me
can,
to read it over there?
Yeah, if you
I'll
can
just
read that, I'll type that in.
D91B as in boy.
Mm-hmm.
5AA.
88?
A is an apple.
Oh, okay. 5A. Mm-hmm.
A.
Mm-hmm.
2 A's. And then 8.
Mm-hmm.
3A as an apple.
Mm-hmm.
207E.
Okay, so we
Got it.
have a green
2
verified.
greens, yep.
We're good. We have a right metacarpal. Site. And it's 1500. Mm-hmm. Okay. All right. Now we have our dial flow. So we want to put on some sterile gloves for this because you just never know if you'll have a reaction to the medication. And we want to scrub our hub with alcohol. Yep, we're scrubbing it. We let it dry. This is okay because it still has the cover. Okay, so here's our saline flush. So we want to be careful not to push too fast. Okay. So Miss Marta, you feel some fluid coming in. So we push and we withdraw and we see some blood return. Then we go ahead and push the saline flush and it's going in nice. Did that hurt at all?
No.
Okay, good. Okay, so then we would take another alcohol wipe and clean it really good because this is the part where we're going to connect the dial flow. Okay, so we're going to connect this part here. That would have a sterile cap. Take the sterile cap off and connect our male and female end. Okay, and then we have this end. Take the sterile cap off. And we have male and female end that we connect. All clean, okay? And then we're clamped off right now, but we want to set this at 125 milliliters an hour. So you just go on here, Lisa, and you find your 125 right there.
Nice. Easy.
Okay, and we unclamp everything. Okay. And we're checking the area. Nothing looks infiltrated. Nothing looks swollen, and we're going to watch 5 drops. And we have 2 drops. 3 drops, 4 drops, 5 drops. We have 5 drops. So we can walk away and we can get our other drug. Miss Marta, just call us if you feel any burning or if you need anything. We're going to get that gentamicin going, okay? Okay. So here we need to chart that we gave the saline. So it was the
Miss O'Connor,
normal saline 0.9% with potassium chloride 20 MEQ 1,000 milliliters, and that was at rate of 125 milliliters an hour into the right metacarpal IV 20 gauge. Okay? Saline, potassium, and used dial flow for infusion. Okay. Okay. Now we're going to give the gentamicin. Okay, Lisa, so we have our bag already spiked and clamped off, okay?
Yep.
All right, so we're going to verify Miss Marta, your name and everything. We have to do that again.
What do we type?
80 years old.
Yep, no allergies.
No allergies.
Yep, we confirm no allergies in the chart. Okay, Lisa, can you read her ID band?
594
594.
090
Mm-hmm.
5652.
52?
Yes.
Okay. Miss Marta came up. Okay, now I have this one. I can type this one.
Let me read it off for you.
I got it. D9, CCD, C5, EC79, B0B. Okay, we got a green verify that gentamicin is the drug. And we've already confirmed everything with the MAR. So it says here we're gonna hang it IV piggyback, and it's gonna flow at 80 milligrams per 100 milliliters. And we're gonna type in that it's 15, the correct time. Okay. All right, so we're gonna get our supplies ready. We have our alcohol and our flush, all that good stuff, and our gloves. And we have our other line there. Okay, Miss Marta, we're gonna hang your antibiotic. So now, Lisa, we wanna just take this one, just drop it down lower, and we're going to connect the IV piggyback to this port right here. Okay?
Mm-hmm.
Okay. So we'll just keep the dial flow there, but we want to clamp this off so we don't make a mess. Okay. And we'll turn this off. Okay. That's on off now. Okay. All right. So you can go ahead and hang this one up high. And we have our cap here. We can actually just hold it in our hand like this for a backflow. Okay, so Lisa, we're just gonna scrub our hub really good. Gonna let it dry. And then we're going to connect our male and female ends. we're gonna open this one and we're gonna open the other one so that we can backfill our tubing. Okay, so you see it going in there? So we're all primed. Okay. So sometimes your chamber will be a little too full. You want about halfway. So then you just squeeze out some extra fluid. Okay? So that doesn't hurt nothing. So that way we can see our drops. Okay? Okay. So then we're gonna unclamp. So that's unclamped. And this is gonna be 100, okay? 80 milligrams and 100 mLs. Okay, that's flowing nicely. And we're gonna watch our drops. We have 1 drop, 2 drops, 3, 4, 5. 5 drops and we can walk away. Miss Marta, do you feel any burning or pain or anything?
No.
Okay, great. What were some of those side effects that we were talking about with the gentamicin?
Dizzy,
Mm-hmm.
hard of hearing, and
Maybe like a skin rash?
and a little rash.
Okay. Well, your call button is in place, and your bed's down low, and you just call if you need anything. Okay?
Okay.
And then Lisa and I have some charting and some other things we'll do, but we'll be close by, okay? So just call if you need anything.
I will.
Okay, Lisa, we have
Yes.
to say all the same things we did before. That we have 80 milligrams of the gent. IV piggyback with the 0.9%. Well, we don't have to put that, right? Just the IV piggyback. 20 gauge IV right metacarpal. Let's see. We have the dose. We gave IV piggyback, 20 gauge IV. It's the right metacarpal. And we have these labels we're going to put up.
How come?
So the IV tubing is only good for a certain amount of days.
Okay.
Hold on one sec. I have to change the time. This one's telling us here. Sometimes when you click on it, it won't take. Okay. So the IV tubing, you just sign and you just date it because it's only good for 48 hours. So 4 days. So today's date. Okay, and then you just sign your name. And we're gonna put it on the IV tubing. Okay? So that way they know that it has to be changed out. And we do it for both of them. Okay? And then did you have any other questions to ask?
Were there any pertinent pieces of information that you reviewed before administering the client the medication?
I looked in her chart, made sure she didn't have any allergies to either one of those medications. We checked her IV site and made sure that it wasn't infected or infiltrated, and we flushed it.
Did this information affect your decision to administer the medication?
Yep, there was nothing wrong. We looked at her labs and her vitals, and we were okay, and so we went ahead and gave the medication safely.
Did this information affect how you administered the medication?
We knew that we were going to give it through her IV, so we just made sure that she had an IV and that the orders were correct.
Okay, man, that's awesome. I hope to become a great nurse like you one day. Thank you so much, Sandy.
Thank you, Lisa.